right, how important is plasma therapy? What are the problems being faced? And most importantly, how can we fix this for the future? Where did we go wrong and where can we actually course correct for the future to be better? I've got Dr. Randeep Guleria, Director of the All India Institute of Medical Sciences with me. Dr. Guleria, thank you so much for speaking on what I feel is now an extremely critical issue. Dr. Guleria, where do you think we went wrong? Because, you know, there are people, and I understand the problem that the medical fraternity is facing. There are many doctors who are saying that most of the patients who are recovering are not willing to donate. What do we do?
So I agree with you that initially there was a very good response and a lot of patients were coming forward to donate. But somehow we have not been able to motivate them. And I think it becomes a responsibility of all the treating physicians to talk to their patients, especially once they've recovered, and sort of counsel them that they should, as part of those who have recovered from corona, should now be able to help others who are in dire need. And if we can start a campaign like that, I think people will come forward. The number is quite large and there is a need to have convalescent plasma for those who are sick. And therefore, we need to develop a strategy that we reach out for them. We may look at some incentives. What we did at AIIMS was that if they were willing, we would stay in touch with them and then even send a vehicle to pick them up, bring them to the center. They would donate blood and we gave them a certificate of appreciation and then they would go back. We've been able to get patients coming to AIIMS to donate plasma, but I do agree with you that the number has come down as compared to what it was about 3-4 weeks ago.
Now, Dr. Guleria, do you think that this is a function of people not being enthusiastic or agencies or authorities not being able to drive this message across? Because, you know, as far as the Arogya Setu app is concerned, let's admit it has been widely accepted because there was a sustained campaign. Do you think we could not the government could not exert itself a lot on a crucial issue like this?
So the issue here is the evidence. The evidence as far as convalescent plasma is concerned is still debatable by a lot of experts because there are few studies which show that it works as far as COVID-19 is concerned. And therefore, even if you look at the national guidelines or other international guidelines, it's sort of a recommendation, but it's not one of the major recommendations, or it's sometimes called an off-label recommendation. Because there is really not that strong a data which would say that this alone will make a huge difference in the management. However, having said that, whatever studies are there, and there is one now study published from China, which about 100 patients were given plasma, do suggest that it may have some beneficial role, especially in the mild to moderate cases rather than the severe cases. Therefore, I think there is a need for us to look at this as an add-on therapy in the current time when we don't have a definite antiviral drug, and this may boost an individual's immunity, and especially if we give it in the moderate stage when his own antibodies have not developed, it will help that individual to fight the infection better. So I think there is a need, but we need to develop a strategy of sort of motivating the people who have recovered to help others. That sort of strategy needs to be developed so that more and more people come forward. And we also develop a mechanism that we facilitate them so that they don't feel that if I have to come to the hospital again, after having been discharged from there's a lot of fear of going back to a COVID hospital.
True.
So the collection part can be at a separate place, which is not classically related to the COVID center.
I think that's very interesting. It could be a blood donation camp away
Correct.
from the hospital also. I think that's a good recommendation, Dr. Guleria. But do you feel, where exactly did we go wrong? Could we have done this immediately after a COVID patient recovered from positive turned negative? Could this blood collection not have been done at that point? See, tracing people down now will be difficult.
No. So the recommendation is very clear that you have to, once the person is improved so that he has enough antibodies and he is definitely not infectious, you wait for 2 weeks and then only do you ask him to donate blood. So you may get discharged, but then you're asked to come back after 2 weeks when you have sufficient amount of antibodies to donate the blood. So taking it at the time of discharge may not actually be that useful. And keeping a person for 2 weeks in hospital just to donate blood may also not be practical. So what I think is important is that even as a part of maintaining, seeing that these patients are doing well post recovery, we should have a mechanism that we keep in touch with them through a telephone call. It could be even once every alternate day, and keep talking to them so that they continue to be motivated, and then arrange for them to come and give their blood, and the plasma can be used, so that that communication channel continues, and they continue to be motivated to donate their blood.
How soon can, say for instance, the government decides to do this right now, and I can't think of any other agency but the government to be able to do this at a pan-India level, because you've got individuals like Doon.com and other websites trying to do the same. But realistically, how much time will it take for a system to be in place for plasma donation ground up?
So what we're trying to do at AIIMS is we're trying to develop a system where we're getting local volunteers, and this could be even undergraduate students, to develop a group so that they can stay in touch with these individuals who can be motivated. We're making a small video clipping which is asking them to come forward and donate their blood, and also messages from people who have already donated blood after having recovered from COVID. So that also we're trying to use to send these to these patients to motivate them to come forward. And a mechanism which can be done at an institution level, it could be done at a government level, of trying to stay in touch with them and motivate them to really come back, rather than just forget about it after 2 weeks.
But you do admit, Dr. Guleria, that while there is no conclusive study, peer-reviewed, scientifically backed, comprehensive global study that this is efficient, at the same time, this does provide relief, and then this mechanism must be kicked off.
So there are studies which show, and there are peer-reviewed studies which show that it may be of some benefit, and therefore I do feel that in our armamentarium, this is also one treatment strategy that we should look at. But having said that, we should not forget the overall treatment that we do to a patient, whether it's oxygenation, whether it's giving the other drugs, the anticoagulants, so that there's no clotting. Plasma is one part of it, but unlike the other drugs, plasma has to be given by patients who have recovered. So a strategy of how do we do that has to be developed. It's for other drugs, it's something that the pharmaceutical company makes, and you are able to get them. But plasma is someone who donates, and it's therefore something that we need to work on a different strategy. And that is why I'm saying that we need to really see how we can keep these people motivated. There is a large number of people who have recovered, and even if, say, 10 or 20% of them come forward to donate blood, that should be a sufficiently good amount.
Dr. Guleria, before we let you go, I just have a request. We here at NDTV have started a campaign where we are requesting people to join us in a pledge to donate. If people have recovered from coronavirus, then they must actually join and donate and volunteer to donate. Would you want to join this campaign, maybe appeal to the people on behalf of NDTV?
I would like to appeal to all individuals who have recovered from COVID-19 that now is your chance to really give back and support those who are now suffering from COVID. And this is a little that you can do. Donating blood is nothing to be scared of. People do it regularly, and this could actually help in saving lives. So I would actually request all those who have recovered from COVID-19 to come forward. It will really give you a lot of satisfaction and happiness that you were able to contribute in saving someone's life.
Dr. Guleria, just occurred, you must have heard about the rising COVID cases in the national capital. It's now even more than epicenter Mumbai. When do you think Delhi is going to see its peak? Because, here it's a peculiar situation where it is the national capital, it shares its borders with different states. Everybody comes here for treatment. In your wisdom, when do you think Delhi will see its peak and then eventual flattening of the curve?
So that's a tough question to really predict the future. A lot of mathematical modeling has been done. Some worked out, some did not work out. But I think as the number of cases are rising, maybe by the end of next month, I would say another 4 to 6 weeks, we should start seeing flattening and coming down. But this is a difficult prediction to make. What really matters is how sincere people are in trying to control the infection. If we are able to maintain good social distancing, wearing a mask and hand washing, and do that while we go out, and as the lockdown sort of is lifted, we maintain that, then the curve will start flattening and come down faster. But if we don't do that and we continue to flout all norms, then the number of cases may continue to increase for a much longer time.
All right, Dr. Guleria, thank you so much for joining us right here on NDTV.
Thank you.